Hi, everyone. We have Professor Scott Atlas with us today, sharing his thoughts on digital health. Um, at the outset, just brief introduction about him. Dr. Scott Atlas is the special advisor to the President of the United States on COVID-19. He's also a member of the White House Coronavirus Task Force and the Robert Wesson Senior Fellow in Public Policy at the Hoover Institution at the prestigious Stanford University, where he's been for many, many years. He investigates the impact of government and private sector on access, quality, and pricing in healthcare, global trends in healthcare innovation, and key economic issues related to the future of technology-based medical advances. He served as a senior advisor for healthcare to a number of candidates for the President of the United States, as well as having counseled members of the US Congress on healthcare, testified before Congress, and briefed directors of key agencies in the federal government. Dr. Atlas is also the editor of the leading textbook in the field of MRI. The book is called Magnetic Resonance Imaging of the Brain and Spine, now in its fifth edition, previously translated from English into Mandarin, Spanish, and even Portuguese. He's been an editor, associate editor, and member of the editorial and scientific boards of innumerable journals, as well as national and international scientific societies during the past 3 decades, and has written more than 120 scientific publications in leading journals. As professor and chief of neuroradiology at Stanford University from 1998 until 2012, and during his prior academic positions, Dr. Atlas has trained more than 100 neuroradiology fellows, many of whom are now leaders in the field throughout the world. Dr. Atlas received a bachelor's degree in biology from the University of Illinois, Urbana-Champaign, and an MD from the University of Chicago School of Medicine. Thank you so much, Dr. Atlas, for joining us today. It's indeed an honor for us. Thank you for accepting this invite. At the outset, since we're talking about digital health during COVID times and post-COVID times, could you give us, a brief insight on how the US has used digital health, effectively during the pandemic? Some examples would be great.
Sure. Thank you for having me, and really appreciate that long introduction. This has sort of been one of the positives that has come out of this very, very tragic period of time, the pandemic. And that is that out of necessity and sort of the need for mobilizing resources and mobilizing medical care and making care available, when people were either forced to not come into medical centers because of sort of a lockdown of medical care, or simply were afraid, because the fear is a big part of this whole time period. It became obvious that people were that one way around some of this was to have a more robust use of distance medicine, telemedicine. And I think this has been a positive, obviously, because, sometimes we don't do things until we need to do them out of necessity. And then when we do them, we think, hey, why didn't we do this beforehand? And so there's been an explosion of telemedicine in the United States, and that is mainly for diagnostic purposes. It used to be sort of the domain of radiology was the main use of telemedicine. And I think, as we all know this, that because the data is digital, and that's sort of been the way that the radiology is practiced, even when you're in a hospital, you're reading from a distance from other hospitals sometimes. And that has changed the face of diagnostic imaging. But in terms of what's happened now, it was clear that people were missing very important diagnostic care. And they did, even with telemedicine. But some of the rules that restricted it unnecessarily were relaxed because of the need to facilitate it in the US. So for instance, health insurance payments for telemedicine, whether it's government insurance or not, were facilitated, were broadened so that people would get paid to do something like that. Oh, and I think there's been a much broader acceptance by patients, because patients that maybe thought it wasn't so great to have to use telemedicine, now they were delighted to be able to use it and avoid going in for medical care. So, out of necessity comes invention, sometimes, I guess, is the saying. And this will be something that is continued forward. I'm 100% certain. I think that it's been better for rural areas in the United States to use telemedicine. There are restrictions and in payments, and I don't think many people understand the U.S. medical care system, but suffice it to say that there's a lot of government insurance in the United States, and healthcare is probably the most regulated sector of all sectors in the U.S. economy, for a variety of levels, both local, federal, state. There's all kinds of restrictions and regulations, and a lot of the reforms that are better for patients involve deregulation, and this is one of those areas.
So, but do you think, Dr. Atlas, was the US able to scale up, if I may, the digitization effort in an appropriate time frame? What were drivers of that?
I think some of that was done. There's no question, but a lot of it involved eliminating the restrictions of using telemedicine, and because of that, that's what happens in a free market, or it's not a free market healthcare system really, but in an economy where innovation is facilitated, what happens is that products are developed to meet the need of a consumer, of a payer, of somebody who wants to buy something. And so what happened was the amount of startup companies and the kind of maturation of startup companies in the telemedicine space was accelerated. So it's a lot more of it for looking at patients, for talking to doctors from a distance. I think a lot of that has been facilitated, and that's grown significantly, just like it has in a way with other parts of the economy. I mean, we've seen companies like Amazon and, delivery to home for products. All this stuff that could have been done before was made, people wanted it now. And so that's what drives, the demand drove the supply here.
Got it. And, I'm sure everyone's curious to hear, right, since you're privy to conversations in the White House and you drive some of those conversations. Does digital health come up in your conversations there?
Oh, sure. I mean, there's all kinds of, the U.S. is, India is very complicated. There's all kinds of regulations, and these things have to be addressed, and people have to understand how they're used. So when there are discussions, it's valuable to actually have had some experience with the medical care delivery system. It's not just about economics. It's not. So
there is a sense of excitement around digitization, or is it more a means to an end?
Well, I think it will end up being my concept of what will happen is that the realization that it is more useful than what was thought is there, and that will drive a more creative use of distance medicine, and it will end up benefiting society greatly, because there are areas of the country, just like in India, that are not near medical centers or not conveniently located, and things can be done much cheaper, much faster. It won't, it's not going to replace medicine, but it is definitely changed the face of medical care delivery, diagnostic, and probably therapeutic too.
Great. And do you think, Dr. Atlas, that this adoption of digital health, do you think it's going to be around forever now, or because human beings do have this tendency of reverting to the mean, if I may?
That's true, but I think that there are more and more creative uses. There's going to be, with 5G phones, with all kinds of, faster and, people are going to have more access to high bandwidth information. And I think it's just part of the evolution of technology that in this case was accelerated by a need that came on sort of suddenly.
Got it. So you think it is going to be around forever, and it's not just once the COVID time ends, we will see telemedicine proliferate.
Well, what's happened in the U.S. is sort of another way to address it, is that because of the lockdown, and then we see that a lot of, not all, but a lot of medical care has come back. But the medical care that has come back, we're talking about things that were, hospital-based care, but as well as the things that we do for, ambulatory care, therapy, and physical therapy. These things. That stuff, of course, is coming back. You need chemotherapy. You get that digitally. But the diagnostic side, I think there's a lot of interest. First of all, there's still a lot of fear. There's a tremendous amount of fear in society, even still, about going into medical facilities, although some of it's gone away. But we're still grappling with things. There's still there's a lot of problems still, and much of which is fear, but there are still other things. And so I think that the telemedicine usage will be significant now, more than before. That's for sure.
No, that's supremely encouraging, because one of the things that has happened over the past couple of months in India is this national digital health mission. I'm not sure if you're aware of it, but it was launched by our Prime Minister on 15th of August, which happens to be our Independence Day, where essentially every citizen of India is going to be issued a unique health identifier. And, all the data is going to be, with patient consent built in, going to be stored in a central repository. There'll be, data exchanges. There's a whole, in fact, Dr. Indu Bhushan, who's also on this panel, will brief us all about it. But so what I'm gathering is that it is indeed exciting, and telemedicine, telehealthcare, and just healthcare digitization is here to stay.
Absolutely,
right.
Yeah.
Got it. And
although I would add, though, if I may,
yes,
there are a lot of concerns in the U.S. I think it's true everywhere, but I think it's particularly in the U.S. about privacy.
Yes.
And the idea that all of the information will be stored in, like you said, a computerized system, that's going to be difficult for people in the United States. I'm making just an opinion here. This is not, I've not studied this. I'm just saying that my opinion is that people in the U.S. culturally or whatever are very, very concerned with privacy, particularly of medical care information. And that is a limit that is going to be there for a while.
You're absolutely right, and those are precisely the discussions that are happening here as well. I would love your thoughts on, Dr. Atlas, the fact that many young doctors, engineers, graduates, biologists are wanting to build careers in the field of digital health and healthcare IT. What would be your advice to them? Both in terms of short term and long term. What should they be focusing on?
Well, I think certainly India is one of these places I view as superb in certain areas. You guys have there's a spirit of innovation and entrepreneurship there that is big, and it could be much bigger. There just isn't as much of an infrastructure and an experience in how to do it compared to, say, where I live in Silicon Valley, where I normally live. But there's nowhere like that in the U.S. either. So, except for there. So, I think you have to, I think obviously education is really critical here, and understanding in a sense where things are going by some experience. Rather than sort of not having any knowledge of where to go once you have the tools to do things. And part of that comes from trying to get educated in a hands-on way with either the industry itself, but maybe even more so, maybe spending some time at some of these early stage investment firms, venture capital firms, and seeing what they're even looking at, because that's where you see what's coming. It's not by working in a company and like working you need experience, but then if you really want to see what the future is, you sort of see what people are working on. There's a lot of ways to go about it, but I think that's very valuable. Part of it, of course, is there's an educational process that's critical, but given that that's obvious, I think one way to do it is to look at sort of private sector, very early stage, try to get some exposure to that. I would recommend that, definitely.
And do you think, that folks wanting to build careers in this field, can they leverage on COVID in any way? Like, given the fact that there's a lot of interest, as we just discussed, in the short term, like, could they, what would be your advice that they can just, follow?
Well, there's a lot of things that are digital besides the obvious. I would start with saying that. In other words, okay, I'm talking about, diagnostic communication with patients or whatever, and all the radiology studies and all kinds of laboratory studies. But there are a lot of things being done, for instance, on a national level to develop a stockpile.
Yeah.
Okay, and that a lot of stockpile information processing and mobilization of resources. There's all kinds of, India has its own complexity. As we all know, the United States has its complexity. The United States has these individual states that have their own management of their healthcare resources, and there's also a federal role for that. So it's very complicated. The systems and for that are maturing now out of necessity. I think COVID taught us something else, which is that the data if you want to make decisions on what to do in the pandemic based on trends, you have to know the trends are accurate. And some of the trends that we have found out were not accurate were deaths per day, hospitalizations per day, cases per day, because a lot of the data comes in. It comes in and it's not really the date of the death is not the same as the date the death is reported.
Yes.
And then, just as an example, if you're looking at a region, so there still are all kinds of problems with the data itself. And so that's another side of IT.
Yes.
And then I would say, so that's an opportunity to figure out, data is very simple unless you look at it closely. And then you realize how flawed the data is. And we're still grappling with that here, as I'm sure you are. The other part of it has been I'll give you an example, is the vaccine development and vaccines that are being worked on. The first few are 2-dose vaccines. And so what does that mean? Well, that means in terms of beyond the simple, mobilization of resources with the vaccines, the delivery, the retail outlets, the clinics where these things are administered, there's all kinds of complexity with data management. But if you think about how important the healthcare IT is for 2-dose vaccines, because you get somebody who comes in, let's just say there's 2 vaccines.
Yes.
And they both are 2-dose, or there's a 2-dose and a single-dose vaccine, because many of these are being developed right now in phase 3 clinical trials. How are we going to keep track on an individual patient who had which dose of which one first? Because the second dose is 3 weeks later. I don't think patients are going to be familiar exactly there's got to be very, very accurate computerized systems for this stuff. There's just a lot of things that come up when you depend on the data, and that you realize, hey, wait a second, our data system is not very good. And so all this, there's an immediate, I think, a lot of jobs in this sort of area right now, and a lot of need for people who are good at this. I don't know how India will be able to do very swiftly a vaccine implementation. It's a complicated country.
Absolutely right.
This is not trivial to go into, Mumbai, and it's going to be very challenging. So, and a lot of the stuff depends on very good IT. And so it's not just, okay, we look at a patient over a Zoom call. There's just a lot more complicated things, but I think the data management, the hospitalization, the resources, the vaccine itself is another issue. And so I think there's so many issues that came up during this.
Yeah. So from what I hear, it's essentially, besides the clinical element of digital health, there's like a full, we can call it logistics, for lack of another word.
That's the exact right word. That's the correct word.
Got it. No, great. Thank you, Dr. Atlas. for your time, for your thoughts. I'm sure there'll be many people who are seeing this who will reach out to you one way or another. And
Okay, great.
I thank
Happy
you
to have
once
been
again.
here. I'm happy to have participated.
Yeah,
Thank you
thank
very
you.
much for having me.